technician, what did my results say? And when the results would say that you are more or less in the safer zone, they would feel relaxed. They would encourage more women to come for screening. And the word would spread in the local community that there is a screening happening. Everyone should take advantage to it. Earlier, the older women came to our camps, the age group 55 to 60, who were largely the mother-in-laws who would come. When they were completely satisfied in Haryana, then they would say, we'll send our daughters. We will send our daughter-in-laws, and they would come. They would just not come for the screening. They would come, they would have a look at the camp. They would look at the complete privacy of it. They themselves would be convinced of it. They would go through the whole procedure. Then they themselves would say, so what are the precautions we are supposed to follow? I would tell them, keep doing breast self-examination from time to time. कहीं पर भी आपको गांठ लगे तो आपको बताना है. So they were like regular, I would say, yeah, from time to time, 3 to 4 months, keep examining your breasts. So it helped raising an awareness regarding a thing. If at the right time they are able to self-examine and get that, then that way they will be able to spread the word among the larger community. Similarly, in Varanasi, what I saw, there women were far more forthcoming because in coming to camps, they were easily mobilized. They would talk about it extensively. The ASHA workers would mobilize them one day, but then the next day when the mobile ambulance would go to their location, they would say, you know why we come? बिकॉज हमने अभी रोटी बनाकर हम आए हैं, अभी हमें आधा 1 घंटे का टाइम है, हम अपना स्क्रीनिंग करके वापस हमें बच्चे स्कूल से आ जाएंगे, फिर हमें उनका दोबारा उनको खाना देना है या मेरे हस्बैंड काम से आ जाएंगे उनको खाना देना है. वी हैव टू रियलाइज द रियलिटीज. Women in India also doing a large part.
Dr. Aishwarya, I really want to ask you because see, I've seen multiple, I'll come back to you after this, ma'am. We've seen that there have been multiple initiatives. What does it take to make an initiative successful on ground? You have district administration working, you've got companies like Nirmai working, you've got other people working, volunteers working. It's a confluence of all of them. It's an effort which has to be done in a dogged manner, pursued. Only then can you take it to a culmination point. So what is your experience on that effect, and what would your advice be?
I would say that every day you have to be consistent at it and try to raise more and more awareness at it. We went again and again and again to the mohallas. For the first time, you had a certain section of women coming in who were more proactive regarding their health and more aware. Then you had, in the second round, even more women would come. Please understand, they have to devote a large part of their daily routine on household work. So we also have to tell women prioritizing your health is a good thing. So this is also telling them to prioritize their health.
What about you, ma'am? What do you say about the volunteers and the social involvement of such campaigns? Because these campaigns can't be successful, or it's not just the government's job to do it. It is definitely civil society and everyone coming together.
Absolutely, it is the civil society's job to see that these kind of things are taken care of, and especially healthcare. I mean, it is, and cancer these days is definitely on the rise. We are all reading about it day in and day out. So for us, it's not only the breast cancer that we are looking at. We look at all cancers in a holistic manner. We do it for men, for women also, both. So both come to our camps. And for us, like I told you, we motivate them through our awareness talks. These awareness talks are done at the community level. They are done at every level. It could be a resident welfare association. It could be just the, the areas, the Anganwadi ladies help us to organize such camps. There are other organizations that invite us to come in and give talks. So you sensitize the people and get them to come in, because stigma, of course, is a very, very big thing. But that gets removed away from the fact when they hear that you yourself have been through it. And when somebody says that I've been through it, and it's kind of a shock for them to say, कि अरे आप भी इस दौरान से गुजरी हैं. They just can't believe it. And, that's why I think they start addressing us as doctors over a period of time, when none of us are actually doctors. It's just that we've had this training on the job. And that's how many of us are called as doctors. Like today also, I think it's written somewhere as Dr. Renuka Prasad, but I'm just a plain volunteer who has been through it and survived for nearly 30 years.
Let me ask next question to the actual doctor. Dr. Mandeep, if I may ask that in a country like India, we have a very diverse set of problems. We have different segments of people. A lot of people in the urban centers can afford healthcare and medicine. A lot of people in rural parts of the country can't afford healthcare. And, so what do you say when the world's largest healthcare program like the Ayushman Bharat has been launched by the Honorable Prime Minister of India, which ensures 5 lakh rupees of insurance to every household, and about 11 crore people have already availed the benefit. What does it do for something like breast cancer and early detection, especially in the rural part of people and the people who need it the most, who don't have the means?
So exactly. The thing is that you have already provided a baseline coverage. Now for us, like the initiatives, has to be that we don't get you the cancer which is stage 3, stage 4. So that even your baseline coverage doesn't suffice that. So we get you the cancer that is stage 2, stage 0. So that this baseline coverage is enough. And that is why this whole initiatives. So the best part is that in India, you have now a baseline coverage for everybody who has no means and who has means can afford. And now who has...
Basically, no one is out of the gambit of the healthcare system. That is something which is really remarkable in that sense, and AI becomes a great enabler to get people to early screening and take the benefit of that policy that has been made by the government.
I'll just give you a small data. If a woman does self-breast, she's able to detect a cancer at stage 2, that 2.53 centimeters lump. So you have to do regular self-breast. Then you go to 6 monthly or 1 year, you go to your gynecologist, physician, ask them a clinical breast by either trained healthcare worker like us or experienced healthcare worker like Renimaji. So when they do it, they are able to detect a lump of around 1 centimeter. So basically what you miss, the clinician will catch, and what clinician will miss, the technology will catch. So if this is the amalgamation, and this was the data, which said that if every woman in India starts doing self-breast, we have 60% to 70% of our breast cancer will be at stage 2. So Ayushman Bharat will take care of that.
So before I come to Dr. Sandeep, Mr. Nanda, I would like to ask you, as and when this program progresses and your LLM gets better, algorithms get better, you have more data sets to work with, how does it impact your efficacy and specificity going forward? And how does it make it better?
Of course, more data gives more power to AI, and AI is also built on a trained model, right? And it's a very important and intelligent layer in the system. But I believe the best use of AI is with human, and of course, doctors play a very important role there. So currently, whatever data sets that we have, and we have built that model, it has also been tested and clinically validated. So for example, clinical validations have been done, clinical studies have been done. Those are done in respected hospitals.
For example?
For example, these are done in HCG hospital, in Narayana Hrudayalaya hospital, Max hospital in Delhi. So these studies are done in comparison with...
Are you available outside India as well as a product?
Yes. These are products are also available outside India in 20 plus
US
countries.
FDA?
Yes, US FDA, the studies are also done outside India, but these studies are done, in comparison with the gold standard. That is very important. For example, every woman walked in, took thermolytics test, then she took mammogram test. And if one of them is positive, then ultrasound. And if ultrasound is positive, then principal investigator, guided for the next line of biopsy. And then the results were compared. And those studies are published. Now that gives, some confidence to the clinical community. I believe a lot of confidence. And then with this kind of coverage that we are doing, of course, more data means more power.
I completely agree with you, because I've been part of this journey with you for the last couple of months and I've seen that happen. I think the true problem, and I'll come to Dr. Sandeep with this, is that in India, we need Indian solutions to Indian problems. We cannot look at generic propositions that exist elsewhere in the world. And therefore, we have to understand what are the sensitivities that we are plagued with. At the same time, I think if India truly needs to democratize healthcare and bring it to the rural sector and the people who need it the most, it would be absolutely, imperative that we are in a position to take these technologies to the people and not wait for it to evolve on its own. Dr. Sandeep, what is your take on that?
I think any technology is of no use if it's not used to if it's not amongst the use of the people. And secondly, the most important part is that Indianized. If you see the diagnosis of even a cardiac disease, is 20 years earlier than what is in the Western population. Same is with the any cardiometabolic disease or any disease like cancer also. So we need an Indian guidelines, Indian system, Indian. I think more often the problems which are related to our countries. Sometimes symptoms are different. Indians can behave in a different way than what Western people are behaving, and I think and technology. I think it needs to be at the lowermost quadrant of the people, because even our prime minister also says that you should if the rural health improves, I think it will uplift.
I mean,
our
the
country.
transformation has to happen
Have to
from
happen in
rural
rural
India.
country.
Only then can we look towards becoming a developed country.
I
in
just
time.
want to add one more thing. Even Indian Medical Association, which I am part of, has adopted this year the theme of Aao Gaon Chale. So I think this is what the utmost important of right now our country is facing, that the rural health should improve. Otherwise, the maximum load or maximum the resources are spent on the health.
So may I ask you, entities, very important entities like the IMA,
Yeah.
are you embracing technology? Are you embracing the evolution of technology? Because there's always a circumspect opinion about something that is new and evolutionary, and understandably so. But what is your approach as an organization, as a body, towards the evolution of technology, especially in AI?
Yeah. So, but then, first the idea came because we are living with the community level. So the idea came that we should adopt a village. We should reinforce the idea again and again, and people should go continuously so that more people are educated. But when the technology comes, and when it is I think it is US FDA is approving sensitivity of 95% sensitive and 90% specificity, like only 10% chances, which I think no other diagnostic test can match at early. So I think when you have total documentation and everything is when you know the technology is true, I think there's no harm in adopting it. And I think we should move forward. Even I will ask my organization also to move forward in this direction, because ultimately the next generation, the next that next theme will be of the technology in healthcare.
And ironically, I just have this one thing to say, that we also try to stay in, along with the times. And way back in 2018, we had our seminar. We have an annual seminar, basically to bring about awareness on the newer subjects, the newer things that are coming up. And AI was just about coming in at that time. And we had
Absolutely.
a full load seminar on AI with healthcare and cancer specific.
I think, ma'am, this journey from AI to AGI will be a path-breaking journey and will unlock many value propositions for a country like India, and the innovators like Nirmay and other innovators who are actually building solutions for the Indian problem. And I say that because we are akin to our problems and we need to work at our solutions. So I think this is the testament of the new India, the new Bharat that we live in. And we have our problems. We will create solutions for our problems, and those will be created very much in India by Indians for Indians. So thank you very much for being a part of this panel. I'm being told the time is up. So but I'll definitely, before I part, I would definitely say that this is something which we have lived through, imbibed through a platform called NXT, which finds alternative and newer technologies, whether they are in healthcare, whether they are in other aspects which touch our lives in different ways and manifest them. And from concept to execution, this entire program took less than 4.5 months. So, that is the beauty about that. And I think we are now, with the advent of AI and AGI, sitting at the single most important scientific invention since the splitting of the atom. So I hope we can have that kind of positive impact on healthcare and a country of the size of 1.4 billion people. And we have our problems, but we have our solutions as well. Thank you very much. Thank you.
दिल्ली में एआई इम्पैक्ट एक्सपो का दूसरा दिन राज्यसभा सांसद कार्तिकेय शर्मा को आपसे हुए थे। एक्सपो में ब्रेस्ट कैंसर को लेकर के चर्चा हुई है, विस्तृत चर्चा की गई है। ITV फाउंडेशन की चेयरपर्सन पंडित ऐश्वर्या शर्मा मौजूद रहीं। सांसद कार्तिकेय शर्मा भी चर्चा में शामिल हुए। सभी अतिथियों ने अपने अपने सुझाव दिए। उन्होंने कहा कि महिलाओं में जागरूकता फैलाने की बहुत जरूरत है। राज्यसभा सांसद कार्तिकेय शर्मा ने कहा कि जागरूकता फैलाना बहुत आवश्यक है ब्रेस्ट कैंसर के खिलाफ। एक्सपो में ब्रेस्ट कैंसर को लेकर के चर्चा हुई है। और फिलहाल के लिए बस इतने खबरें लगातार जारी है, देखते रहिए इंडिया न्यूज।